Hey everybody, Dr. Hagmeyer here, and we're continuing our thyroid series titled The Most Commonly Asked Questions About Hypothyroidism, where I picked 14 of the most commonly asked questions that people email me and answer them. Now, today's question is from Lauren down in South Carolina, and her question is Dr. Hagmeyer, I've been diagnosed with hypothyroidism, and I want to know what kind of foods do you recommend that I avoid? Okay, and this is an awesome question because here we see that Lauren's already thinking about lifestyle changes and thinking about food as being medicine, rather than how do I treat a lot of the different symptoms with these medications. Okay, in fact, it was the father of medicine himself, Hippocrates, who's quoted as saying, "Let food be thy medicine." So I wish we could get back to those roots. So what foods should you avoid eating? Okay, well, I would recommend that if you have Hashimoto's disease, then it's pretty safe to say that you need to be on a gluten-free diet. Okay, numerous studies, study after study, done in many different countries around the world, have actually shown a link between gluten intolerance and Hashimoto's disease. Okay, so if you don't know what gluten is the protein found in wheat, barley, rye, and oats. And each of these grains have gluten-like proteins that are similar enough to the gluten protein found in wheat. And this protein structure is very similar to that of the thyroid, and so the body, the immune system itself, can mistakenly identify the thyroid as not a friend, but as a foe. And then, of course, it begins to attack and destroy the gland, which then eventually causes all these nasty symptoms. Now, some people can have additional sensitivities to many of these other grains. So you might be on a gluten-free diet, but you're not noticing that much of a difference. Well, what I always suggest and recommend for many different reasons, which I'll explain why, is that things like spelt and buckwheat and amaranth and rice and corn and buckwheat and quinoa and some of these other grains can be what's called cross-reactive. And so my best suggestion and recommendation here is if you get tested for gluten sensitivity, you should also be tested for what's called cross-reactive grains as a starting point. And this very quickly can help rule out foods that are really not compatible with your body's immune system. Okay? This kind of testing is also important because many of the medications that people take, and even the cosmetics that many women use, actually contain hidden sources of gluten due to the binders and fillers that are in them. Okay, so if you visit my website, you can download a free guide that I put together. It's probably about 3 or 4 or 5 pages perhaps, and it basically is titled Hidden Sources of Gluten. So if you just go into your Google search and you just type in Dr. Hagmeyer, Hidden Sources of Gluten, you'll be able to find that guide and basically download that. So the next big thing is to eliminate iodine, and this is especially important if you have Hashimoto's. Men and women, if you're out there and you're watching today's video and you have Hashimoto's, you need to stop using iodine, okay? Iodine is found in table salt, it's found in many multivitamins, it's found in protein shakes. In fact, many of the supplements that are out there that are designed to help support your thyroid actually contain iodine in them. And since we know from watching past videos that the #1 cause of hypothyroidism in the United States is Hashimoto's disease, it only makes sense that you have to be very, very careful about this, okay? The other thing is if you go out to dinner, make sure that that fillet that you order or that T-bone steak that you order or the vegetables that you order also haven't been salted, okay? So little things like that you want to be aware of. Now, some other suggestions that I have when it comes to diet would include cutting back on sugars, eliminating coffee, limiting fruit to those fruits that fall under a low glycemic index number. That's very, very important. A big misconception that I hate to say this, litters the internet is that you should eliminate these goitrogenic foods if you have hypothyroidism. And I don't believe this to be the case at all. In fact, there's no scientific evidence that really supports this. And in fact, many of these foods, these cruciferous foods like cabbage and broccoli and cauliflower and collard greens and kale, all these vegetables actually contain compounds called I3C, indole-3 carbinol. And in fact, many studies are actually showing how beneficial these vegetables are, these green foods, in preventing cancer. So again, this is something I would encourage all of my patients to eat on a regular basis. Okay, so there you have it. I hope today's thyroid tip serves you well, and I hope you just find tremendous resources in these short videos that we're doing that help you get back on track. Take care.